If you've spent hours on the internet trying to learn about ADHD medication only to end up feeling exhausted and confused, you've come to the right place. I've spent 20,000 hours prescribing ADHD medication to adults. Here's what really matters. In part 1, I'm going to break down ADHD treatment best practices. In part 2, you'll learn what to expect and when. In part 3, I'll give you the big picture to help set expectations after your ADHD medication has been successfully optimized. And stay to the end, because I'll show you my very own framework for adult patients with ADHD that also want to manage emotional dysregulation, anxiety, and complex PTSD. Now, before everything goes and gets a little complicated, let's just take a moment and relax, because I guarantee by the end of this video, everything will make a lot more sense. First things first, you gotta trust the process. Now that we know you have ADHD, we need to find the right level of stimulation that is going to be therapeutic for your ADHD brain. The devil is in the details. That's why as a provider, I make sure I'm crystal clear about what ADHD symptom the patient is dealing with, in what situation and circumstance. And not just, does it make your focus good? You start with either Adderall XR or Ritalin long-acting 20 milligrams every day in the morning, and then you reassess. We need to get out of the moment and assess medication response over time. If Adderall XR works, but you have side effects, you switch to Vyvanse. If Adderall XR doesn't work, you switch to methylphenidate. We're not meant to get it right immediately. It's an assessment of initial response. If methylphenidate works, but has side effects, you switch to Focalin XR. But if methylphenidate doesn't work, you switch to Adderall XR. If a patient doesn't tolerate a stimulant, we'll go to a non-stimulant. And no, I am not talking about guanfacine or clonidine. I'm talking about Strattera or Qelbree. Usually, we're able to find the right dose pretty quickly. A one-a-day extended release medication that is all good and no bad. You just start to take it like a vitamin. There's still a lot of old medication advice out there. When extended release stimulants came on the market around the year 2000, it changed the game. We can expect things that we couldn't have expected before. No more drug holidays. You can get a good response from that medication every single day. Now, you can think about habit formation in a sustainable way that will change your behavior beyond medication. If you want to go deeper on medication, I pinned my top 3 most important ADHD medication videos in the comments section. Okay, I get it. People with ADHD have busy minds. They need to know all the information. What's gonna happen? What's the best dose? What's the best medication? We need to pump the brakes. You're still stuck speeding on the hyperfocus highway, and if you're not too careful, you're gonna crash out. Slow down, pull over. It's time to adjust to a more recreational pace. Welcome aboard the ADHD Riverboat Express. With the right amount of stimulation applied to your brain, you can appreciate the little things, even in a low stimulation environment. But along the way, over the course of the next month, many are going to realize they still have ADHD. Maybe things will have changed a little or a lot. But either way, when the Riverboat Express pulls up to your provider's next appointment in a month, you're gonna have way more field notes to use to know which direction to sail in next. If this seems silly to you, it's not. Because ADHD is a lot like a jungle expedition. Exciting, exhilarating, challenging, and you're bound to discover some unexpected surprises along the way. Like that it's still gonna require willpower for you to stay organized, or that it's gonna take some trial and error before you develop systems to stop forgetting where you put your car keys. And yeah, you will still fail to initiate tasks. The difference? It doesn't immediately just vanish out of existence. It stays with you. You actually remember to prioritize the problem you just encountered rather than forgetting to remember it all. But here's where our little boat ride ends. Because where treatment heads next is a lot more like a choose-your-own-adventure for your nervous system. Sometimes people start ADHD medication and everything just falls right into place. Other times, it allows people to delve into therapy to address issues like emotional dysregulation, anxiety, and complex PTSD. Even though I hacked my ADHD brain and wrote a book about it, it worked for me. But it may not work for somebody else. Here's a truth bomb. You are so much more than ADHD. It's really about our nervous system, our involuntary reactions and responses to things. In other words, it's our defense mechanisms that dictate the course of someone's life improvement. Instead of what's on my to-do list, it becomes, now that my ADHD brain is fully online, What direction do I want to take my life in? Many paths, same direction. Protect your energy. That's why I developed the Survival Modality, which comes from decades of academic study and clinical work. This framework has become a vital tool in my practice, which helps my patients understand themselves and their connection to others around them so much better. Ultimately, it's all about moving beyond ADHD to help improve each patient's quality of life and mental health. So that's everything you need to know about ADHD medication. If you want to know more about ADHD medication in the adult population, I have an entire playlist for you right here. But if you're ready to move into the survival modality, I got that playlist for you right here. And go ahead and hit subscribe if you want to keep receiving practical strategies from a nurse practitioner who won't sell you short.